And we will get started with our week 3 presentation. Share. All right, here we go for our week 3 presentation. Okay, so this week we're going to be going over Abicularis oculi, or the crow's feet. We're going to go over how you sign a chart in Aesthetic Record. And we're also going to kind of talk about cash and kind of Venmo and Zelle and kind of tell you like how that kind of works out. And then also for AR review, we're going to briefly go over Care Credit and Cherry. And then we have our marketing ideas and homework for the week. Okay, so let's talk about Abicularis oculi. So Abicularis oculi is the crow's feet. So this is, remember, a medium muscle group. So kind of think back to training. You had large, medium, and small muscle groups. The large muscle group, the only one is the glabella, and it can handle 10 fluid units into each injection point. The Abicularis oculi muscle is a medium muscle group along with the frontalis and the mentalis muscle, and it can handle 5 fluid units into each injection point. So for the crow's feet, it is considered a medium muscle group. The traditional pattern is going to be 3 injection points, and they do kind of make that nice kind of V pattern. They kind of point towards the ear, so that's always kind of a good way to know kind of how your V pattern is supposed to go. It points towards your ear. And when you're injecting, you want to be at about a 45-degree angle or so. And you want to make sure that you are not injecting towards the eye. So always make sure you're injecting away from the eye and kind of up and out. Never inject down, because you have that risorius muscle kind of down here. And if you accidentally get that muscle, it can make the patient's smile uneven. So always inject kind of up and out whenever you are doing the Abicularis oculi, or the crow's feet muscle. For Botox and for Jeuveau, as far as charting purposes go, remember that 10 equals 4, 5 equals 2, and 2.5 equals 1. So if I'm going to use, let's say, Dysport, I'm going to be putting in 5, 5, 5 fluid units into each injection point, just like Botox and Jeuveau. It's totally the same. And then for Dysport, I'm going to go and chart 5, 5, 5. So Dysport is the absolute easiest for charting purposes. But then for Botox and Jeuveau, instead of charting 5, 5, 5 like you did for Dysport, you are going to be charting 2, 2, 2. Because remember your Bible, 10 equals 4, 5 equals 2, and 2.5 equals 1. Any questions at all about how to inject the crow's feet? Nothing? Perfect. Okay. Moving right along. All right, so now we're going to go over how you sign a chart. And this is something that you're going to do at the very end of every single month. Oh, does somebody have a question? Nope. Okay. At the very end of every single month, this is something that you're going to be doing. And we actually have a graphic for you of kind of how to close the month out as far as checking your charts, making sure you sign everything. You always just kind of do a quick, glance at all of your product, make sure you kind of know, where everything is, check expiration dates. So it's just kind of closing the month out. But a really important thing to do is to sign your charts. That means to send them to your supervising physician. Here at MFL, your supervising will actually sign 100% of your chart. So every single chart that you do will have a signature on it. And then we also audit 100% of the charts as well, just to make sure that everything is correct. We want to make sure that you have your consents done, your photos done, your traceability is complete. All of that is done because we want to make sure that everyone's license is absolutely safe. So we have a dedicated person named Bernard, and he actually goes in every single day and he checks every single chart for that day. So if you get an email from Bernard at the end of the month, it will say, hey, you need to go in and there's some things that you need to kind of fix on your chart. You're missing your traceability. You're missing a note. You're missing, this and that. And that way we can make sure at the very end of the month, everything is perfect before we move on to the next month. So this is how you sign a chart. So in Aesthetic Record, you have two ways to access it. You can access it through the app, and that's how you do all of the patient charting and all of the patient, point of sale. All of that takes place on the app. For signing the charts or to go in and accept your stock transfers from Stephanie, all of that actually takes place on the .com. So that is the web-based. Now you can still do it from your cell phone, but you have to go into Safari and go to www.aestheticrecord.com. So I actually just have it saved on my computer. So I'm going to go into the .com on my computer. So you're going to go ahead and you're going to log in to Aesthetic Record. So go ahead and log in. So again, this is not the app. This is the .com. I'm going to go ahead and log in. And when you log in, it's going to start, it's going to pull up your dashboard. And I'm actually in the wrong, let me pull up Texas. So it's going to actually pull up your dashboard. And you can set your dashboard to look like whatever you want. So the reason why I have more ejectors on here is because I have access to everybody. So you will just see your numbers on here. So how you sign a chart is you're actually going to go all the way over to here to Provider's Room. So once you click on Provider's Room, you're then going to make sure that you are on cosmetic procedures. Make sure that you are not on health procedures, okay? So make sure you are on cosmetic procedures. And this is a great area because you can actually see everything that needs to be done. So I obviously need to be updating some traceability for this month. So I'm going to be doing that before I sign all of these. So these are all of my April charts that I still have to complete, okay? So I know that, let me go in. All of these will be green. Please ignore the prescription one, okay? So this will never have a green check mark on it, okay? So don't worry about this, but all the other ones must be green. And it's pretty easy to update traceability from the .com as well. So I'm gonna go ahead and I'm gonna pull up Allison Howard. And this is her chart. So you can see I went ahead and I did Dysport on her. And I can actually update my Dysport traceability from here. Let me actually see if I have enough in there. Nope, I don't. Let me do another one. 1 second. Let me do Lexi. It's gonna be Dysport too. Hold please. Sorry, I haven't done my stock transfer. Kelly. Nope. I mean, all these patients got Dysport. Let me find someone who is not Dysport. Let me see, what is this? Okay, let me see if I have Chubo. No, awesome. Ignore my stock transfer. I have not done that in a while. So let me find one that's all green. Okay, so this one is all green. So how you simply sign the chart, you can actually select it. And if you want to select multiple, you can, but you simply select it. And then you're going to go all the way up here and you're going to click action and you're going to click sign and send to MD and it will save your signature. It will automatically select your supervising physician. So that don't worry about having to select a new one. And go ahead and select complete. And now that particular chart has been sent to my supervising physician. So I have other ones that I can do. Again, all of these will be green. Please ignore the last one, which is the prescription one. So I can go in and if I want to do additional ones, I can. I actually have to sign a bunch of charts. Jordan's going to get mad at me. So really easy to do to sign your charts. Okay. And again, that has to be done at the end of every single month. Any questions on how to sign charts or do anything like that? Nope. Everyone's good with that?
Does that need to be completed by the last day of the month?
Yes, by the last day of the month.
Got it. Thank you.
Yep. Okay. Moving on. Okay, so My face lady, we are officially cashless. And the reason why we are cashless is this is something that the injectors have actually been asking us to do for a long time because they're like, oh, we hate having to go to the bank to drop cash off. So can we please just officially go cashless? And yes, so we are now officially cashless. And this was at the request of the field of injectors. So instead of cash, we do accept Venmo and Zelle. If they want to Venmo, they can Venmo the company, and it's simply that at my face lady, that's the Venmo. Or if they want to Zelle, the Zelle email is pay@myfacelady.com. So they can, and you still kind of go through everything the exact same, but we no longer officially accept cash. So please know that. Any questions on cash? Excellent. Okay. So we're going to talk a little bit about Care Credit and Cherry. So Care Credit and Cherry are both different ways that patients can pay. So they are kind of like credit cards. So Care Credit is not part of aesthetic record. So it is a two-step process. While there is a Care Credit button in AR, it doesn't actually link on the back end. So if you do accept Care Credit, please know that it is a two-step process. So you can simply go through everything on AR and then you'll hit Care Credit and then hit checkout. But then the second part is you are going to have to go to www.carecredit.com and you type in this exact website. This is all on the Facebook page for your reference as well. And then you will go to Pay Now under on the right-hand side, and then you'll select you'll put in the patient's data. You'll fill in all the payment information and how much that the Care Credit is supposed to be for. And then you'll select the promotion, review it, and confirm. So that's actually how MFL gets paid, is on the back end. So your responsibility, if you do accept Care Credit, is to do both sides. So you'll go in on the aesthetic record side and close the patient out. And then you'll also go in on the Care Credit side and then select the correct payment method as well. Now, for Cherry is very different. It is fully integrated with an aesthetic record. So you can actually click Cherry and the patients will be immediately approved on Cherry. I've never not seen somebody approve for Cherry. And then it will kind of pull all of their information in. They will fill everything out on Cherry right then and there. And then it will simply apply the credit and everything can be done from the app. So Cherry is very easy as well. Any questions on either of these two ways to accept payment?
So do you usually offer cherry since it's just a little bit easier?
I do. I mean, but then I probably have 3 patients that actually use Care Credit. And I guess they just signed up for it at another med spa. And so they already have their, all of their stuff. And so it's, now it's pretty easy for me to do, but I prefer Cherry just because it's so much easier because it's fully integrated. And then MFL gets paid immediately, and then Cherry will actually bill the patient. And then they can set up the terms for, do they want to pay it over 3 months, 6 months, 1 year, however they want to do it on the back end.
For Care Credit, is it the same as like doctor's offices? Is it like 12 months interest free? Okay.
Yeah. It's basically like a credit card, but for healthcare stuff. Okay, so let's move on to the marketing homework for this week. So this week, we are actually going to have you reach out to 2 salons this week, okay? Salons can be anything from esthetician offices, doctor's offices, dentists. It can be massage places. It can be physical therapy. It can be really anything that you can think of can be a salon contract with us. So you're going to reach out to them and let them know, hey, I can do events at your place. We will actually rent out their space or rent out their chair. We actually pay the owner per patient. So for Botox, I believe, or for neurotoxin, it's $20 a patient. And for filler, it is $40 a patient currently. So the salon owner will actually get paid for us allowing us to use their space. So it's a great way for salon owners to kind of fill that space and fill that void and also offer additional services to their clients. And then obviously for the injector, it's a great way to kind of get additional patients. You can inject multiple patients at a salon account. I have one salon account that I do probably an event every 2 months or so, and they're pretty large events. So I've been seeing my particular salon account for probably the last 4 years. So it really is a great partnership. Everyone loves getting salon. So your homework for this week is to reach out to 2 salon accounts. We do have a flyer, and I will make sure that we put it on the Facebook page for you too. That way you can, send them any information on, what it looks like on the back end. And then this week on social media, you're going to be posting before and after of crow's feet. And I already have a graphic for you. So if the patient uses Jeuveau, it's actually going to be like pretty much a flat $145. So it's a simple way to kind of say, hey, if someone's like, oh, I don't know, price per unit, it's $145 when they use Jeuveau, and you do the standard kind of 3-2-2-2-2-2-2 pattern. So we have that graphic for you. Again, I will post it on the Facebook page this evening. And then the last post that you're going to do is just an education post on what is resting stasis. And this is going to be a post that you do totally on your own. Okay. So you're going to come up with a verbiage. You're going to come up with a graphic, some type of educational post on what is resting stasis and what is neurotoxin going to be do to help it. And this is the week that I actually have you start following additional people on social media. So if you think back to training, I kind of talked about how there are a million different ways to skin a cat. And so I taught you one way in training how to do someone's crow's feet, how to do someone's lips, how to do someone's cheeks. But there are so many additional ways out there to learn. And so my goal is for you to try to get exposure to as much education as possible, not only within MFL and Aesthetic Institute, but also from other injectors in the field as well. So for this week, I'm going to have you follow 2 people. And the first one is Professor Sebastian Codofana. He's on Instagram. He is kind of a cadaver guru. So he really just goes into a lot of anatomy. So really follow him on Instagram, and just every now and then just kind of click on his page and kind of listen to some of the things that he's saying, because you're going to continue to add tools to your toolbox. And then the other one is going to be Dr. Tim Pierce. He is really, really good about doing a lot of education posts. He injects very similar to the way that I taught y'all to inject in training. So I really want y'all to start digging into all the additional things that are out there to learn online. Just always remember that you're going to see things out there that are not safe. And I will always be giving you people that I think that are injecting the safe way. So Dr. Tim Pierce talks about aspirating. He, wants you to make sure you know anatomy. He's very good at what he does. So everyone that I will be giving you injects in a safe way. So that is for this week. Are there any questions about anything that I went over?
I have a general question.
Yep.
Are we, for Botox and Jeuveau, we're charting that in AR with the fluid ounces or the medical units?
The medical units. Yep. So that's where you chart. So if you're using Botox and Jeuveau, you're not going to be charting 5s, 10 5s and 2.5s. You're going to be charting, 4, 2, and 1.
Okay.
Okay. So if I'm going to put in 50 fluid units of Botox, right? I pulled up 50 units in my insulin syringe, and I did 10, 10, 10, 10, 10 fluid units, and I, injected the patient. And now I'm going to go and chart an aesthetic record. I'm going to chart 4, 4, 4, 4, 4. Does that make sense?
Yes, thank you.
Perfect. Any other general questions?
I had a question for the launch party.
Yep.
Is our trainer going to be bringing like the basic necessities to the
Yes.
party?
Yep,
And then
they'll ask you
that-
your glove size and all that kind of stuff.
Okay, perfect. And then moving on, then we just order that stuff through Stephanie, correct?
Correct, yes. And remember, at your launch party, you must inject 3 patients. Okay, so
Okay.
over invite for your launch party.
And that's another thing I have. If you have more than 3 people, will the injector stay to do like the telemedicine on those, or do we need to call in?
No, if you need a tele after the 3, because the onboarding specialist will, because after your 3 patients, you're kind of good. You can get a tele at that point, and it'll be most likely Lauren doing your telemedicine.
Okay, perfect. So then we just have to, communicate with
Lauren.
That
Yep.
on that day. Okay,
Yep.
thank you.
And if you get at your party and like no one's answering, hit code Telly. And I mean, I'm sure that most of the nurses, y'all are already in the Telly group. You saw today that there was a couple code Tellys and like I picked up one and Lauren was like, no, I'm here. So there will always be somebody available for you.
Got it. Thank you.
Yep. Who still has to have their launch party? Gabby, have you had yours?
No, it's this upcoming Sunday.
Am I doing yours?
No, it's I forgot her name. Let me see. I have her saved under here.
And you're doing mine, Lauren.
Okay. I was like, I'm doing
Okay.
someone's in Corpus Christi and I couldn't remember
Yeah,
who.
that's me.
Okay, perfect.
Amber Nelson's doing mine.
Oh, perfect. Okay. Lauren, I can still do, if it's me, then I can still do your Telly because I'm going to be there
Okay.
until my flight takes off.
Okay, yeah, that's what I was wondering. I was like, I think I'm gonna have more than 3, so I wanted to.
Yeah, not a problem. Yeah, because I'm going to be there. My flight gets in pretty early and then I'll do your launch party. So I can stay until pretty much I have to take off for my flight.
Okay, that sounds good. Thank you, ma'am.
Yep, absolutely. Alexis, have you had your launch party already?
No, mine's actually May 5th.
Perfect.
Clarissa,
Okay,
yeah, Clarissa's doing mine.
great. Shannon, have you had yours?
Yes, I had mine and I had 3 clients yesterday as well.
Excellent. How did it go?
It went really well. They
Wonderful.
seemed pleased.
Good, good. Suki, Kayla, what about y'all? Have y'all had your launch parties yet?
Yes, I
Mine is-
had mine already.
Okay. And Suki, have you had yours?
Yes, ma'am, I already had mine. I
Excellent.
had mine before I went to go see you in Houston for my fillers.
Good, perfect.
Yeah.
Oh, I forgot about that. Okay. And Suki, you did such a great job with fillers, so you did excellent.
Thank you. Thank
Yes.
you. I had a good teacher.
And Kelsey, have you had yours yet?
Yes, ma'am. I had mine yesterday. I had 4 clients.
Excellent. How did it go?
It went really well, except for Kristen. I already got my my normal people hooked on numbing cream for lip flips.
I'm sorry, say that one more time.
Kristen, she had numbing cream from her filler and she used it on one of my girls for a lip flip. And I was going to get another lip flip, but Kristen had left and she was like, wait, you don't have numbing cream?
Oh, for a lip
So,
flip?
Yes.
Yeah, and you don't really have to use numbing cream for, I mean, I don't. I mean, because it's 2 injections and it's real fast. So I don't use that for a lip flip, just so for the future. So you know that. But if a patient saw it used on somebody else, I'm sure they were like, yeah, I'm not going to do it now.
Yes, that's exactly what happened. And even the girl that I got it done with the numbing cream, she was like telling her, she was like, it's fine, it's not that bad, like just do it without it. But she was like, no, I want the numbing. She got
Yeah,
scared. So
you'll do it next time. You get some and you can do it next time. And then you'll be like, it's not really helping that much, but. All right. Well, I will go ahead and get this recording put on the Facebook page, and then I will make sure I get those graphics out to y'all and all of that kind of information. And I will see everybody next week. Y'all have a good Sunday. Bye, guys.
Thank you.
Thank you. You too.
Thank you.
thank you.
Did you say the code word yet or the
Oh,
magic word?
no, let's do pink chicken. Pink chicken. So, all right. See y'all next week. Bye, guys.
Bye.